Hello, good evening. My name is Dr. Chudi Ufundu, and this is Snowspirations Evening Open Clinic. Now, because we are just starting a new month, I needed us to start a new month with good understanding of the female reproductive system. So this is a typical internal female reproductive system. So what I plan to do this evening is to help you to understand the different functions of the important female reproductive system. So when you join today's clinic, it's going to broadcast on 3 platforms. It's going to be on our group, it's going to be on my personal timeline, then it's going to be on our main page. I'm broadcasting from our community health page. For some reasons, we've been having problems on our main page, so we've not been able to broadcast from our main page, but I'm currently broadcasting from the community health page. But the video is going to be shared on all our platforms. So if you're my personal friend, you can see me right now. Thank you so much. I appreciate you joining. If you're in our group, Snowspirations Health Hub, thank you for coming. If you happen to be on the main page, you can also see me there. If you're in my private Snowspirations page, you will also see me there. So there are different ways you can participate. For some strange reasons, I also cannot read some comments. So when I'm done with my presentation, I'm going to skim around to see if I can pick comments and questions from different platforms. So thank you so much. Let's talk about what we are here to understand this evening. So this is a beautiful work of God. If you're a woman, can you take a moment and applaud yourself? Just give yourself a round of applause. You rock. It's not easy to be a woman. I don't know if I could have felt better becoming a woman because women are strong. Matter of fact, incontrovertible truth, women are stronger than men. Women have long lifetime expectancy compared to men. Meanwhile, women go through a lot regarding perpetuating our family, our community, bringing for the kids, bleeding every month, going through pregnancy, going through labor, going through CS, going through breastfeeding. It's a lot that women do, so we have to appreciate them a lot. I'm not here for competition. I'm only here to appreciate women. Now, if you're believing God for a baby and you are not yet a mother, it's a matter of time. It will happen. If you understand your role as a woman, if you understand your role as a mother, if you understand your internal female reproductive system, then you are 50% ready. The entrance to female reproductive system is actually through the vagina. So this is the vagina. Okay, so this is a hollow tube. It's a hollow, strong tube. Now, this is the internal part of the vagina. The part of the vagina you see outside is called the vulva. You have to know the various parts of the vagina, the ones you see outside. So it's comprised of the mum pubis. Mum pubis is that area that hairs can grow. It's called the mum pubis. Now, if you begin to go down from the mum pubis, you will get to the labia majora. So labia majora, it's that fleshy part that will now collapse into the labia minora. So I want you to pay attention to all this. You can actually go and check yourself out because part of being aware, part of having knowledge is to know your body. I know some people will be like, oh, but don't do this. But come on, you need to know your body. You need to know the various parts of your vagina. Matter of fact, you need to teach your young girls. Once your girl is currently bleeding, it's the appropriate time to teach her about the female reproductive system so they can look after it properly. Proper hygiene for women is very important because when you bleed every month, you have to maintain proper hygiene. So externally, you have the mum pubis, labia minora, labia majora. They will collapse to yield the clitoris. The clitoris is the most sensitive part of the female reproductive system. That's where they have a lot of nerves. That's the most sensitive part of the female body by leaps and bounds. Now, mom pubis, labia majora, labia minora, the clitoris. Now you begin to gain access into the vagina. That's when you will now get to this hollow tube. So this is the vagina. Now it's important to understand that women have two openings in the vaginal area. There is an opening where urine can come out, and there is an opening where you bleed and your baby can come out. You have two openings. Make sure you understand this. I'm sure some women might not really know this, but yes, you have two openings. Now, when you go beyond the vagina, so what's the role of the vagina? The vagina is a strong, cylindrical, muscular organ that receives the penis. So the penis will fit firmly in the vagina. The penis has to be erect. A limp penis cannot penetrate and be in the vagina. So it has to be erect and turgid. When it fits into the vagina, in course of sexual intercourse, the penis will ejaculate. So the vagina will receive the penis in course of sexual intercourse, and when the penis is done with its job, which is continuous thrusting in course of love making, which you should be conversant with. If you don't know how to make love, learn how to make love. It's very important. Now, at the peak of that love making, the penis will ejaculate. When the penis ejaculates, it's expected the penis will be limp or flaccid. Now, beyond the vagina, so the vagina will hold the semen. Then beyond the vagina, you get to the cervix. This is a very, very important part of the female reproductive system. So the cervix is the mouth of the womb. It's the junction between the vagina and the womb. So this structure is the cervix. Let me come closer, maybe you can see. This is the cervix. This is the vagina. So the cervix is so important to the extent that anything that affects the cervix can affect your chance of becoming pregnant. There are times we want the cervix to be open. There are times we want the cervix to be closed. Before pregnancy, we want the cervix to be open so that you will receive the sperm. Thankfully, the cervix is user-friendly in women that want to become pregnant. The cervix produces cervical mucus. Cervical mucus has a lot of things that will support the sperm to come in, so the sperm can swim. The sperm are swimmers, so the ability to get a woman pregnant is dependent on the ability of the semen and the sperm, which is deposited in the vagina, to swim past the cervix. So the cervix has to be very user-friendly. Release the fluid, aid the sperm to come in. Now, there are times we want the cervix to be closed. When pregnancy has occurred, we don't want the cervix to be open, because if the cervix opens, the baby will escape before 37 weeks. Now, when you go beyond the cervix, you now enter this beautiful butterfly structure, the shape of a heart. This is the almighty womb. The womb is comprised of three different parts. The internal part of the womb, which you can see, is covered by what we call the endometrium. The endometrium is very important. The endometrium has to be thick enough to support pregnancy. The endometrium is where pregnancy will start developing after the process of implantation. Your womb is actually the strongest organ in the body. This is where your baby will develop. Unfortunately, some women can have some pathologies. They can have polyps, they can have fibroids, they can have adhesions, they can have cancer and all that inside the cervix. All this stuff can affect your ability to become pregnant. But beyond the cervix, beyond the womb, you now begin to go to the tubes. So every woman should, by default, from birth, have two tubes. They are called the fallopian tubes. Fallopian tubes are very important in the process of natural pregnancy. For you to become pregnant naturally, we need at least one open fallopian tube. What can the fallopian tube do? It plays three roles. If you notice, this is another important part of the female reproductive system. Matter of fact, the most important part of the female reproductive system is the ovaries. This is where your family lives. This is the most important part that will make you a mother, because you're coming into this world with about 2 million eggs, which are housed either in any of these ovaries. So by the time you become of age and you start ovulating, every month you'll be releasing one egg. And there are so many other eggs that will be, getting released and be damaged. But this is the most important part of your female reproductive system. So the function of the tubes. When the egg is released through the process of ovulation, this part of the tube, which you can see has some finger-like projections, will pick up the eggs, bring it into the tube, and wait somewhere we call the ampulla. Now from this end, when the sperm enters the vagina, passes through the cervix, gets to the womb, it will enter this part of the tube. This part of the tube is called the proximal part of the tube. The sperm will enter here. It will now go and meet the egg in the ampulla. Remember, the egg is already, entered from this end. When it gets to the ampulla, one lucky sperm out of millions will fertilize the egg. When it fertilizes the egg, at that stage, the egg is called the embryo. The third function of the tubes. When we have succeeded in having fertilization in the tube, that particular embryo is not supposed to start developing there. It will come down, it will travel, and come back and start developing in the womb. So two important points you need to note this afternoon. Pregnancy happens in the tubes. Fertilization happens in the tubes. Development of the pregnancy happens in the womb until 9 months. Now for a woman, if anything happens to one of these tubes, but the other side is open, you can still become pregnant naturally. So what we need is to have at least one healthy tube. Unfortunately, if both tubes are damaged, you can still become pregnant, but at this time you're going to use IVF because the natural ability of the tubes, we have lost them. So this is the standard female reproductive system, and there are various roles. The vagina, amazing structure. The cervix, the womb, the tubes, and the ovaries. If you know this, if you keep this healthy, nothing can stop you from becoming a mother. Absolutely nothing. The reason why you're a mother in the first place is because when you're coming into this world, you came in with 2 million eggs. Of course, you're not going to have 2 million babies. So over time, you will keep having a lot of wastages of the eggs until sometime you will now have only few remaining. By the time you get to age 35, a whole lot of your eggs must have been lost. So you have fewer eggs, and out of those fewer eggs, fewer quality eggs. So a woman will not be productive all her life. As a woman is getting older, her chances of becoming pregnant with her own egg is reduced. You need to understand this because there are so many women, when you tell them what to do, they say, oh, I'm waiting on God. You might be a Christian, you might be waiting on God. By the time God is ready, you haven't used your eggs. So your eggs will finish. When your eggs finishes, you enter menopause. When you enter menopause, you no longer have eggs. When you no longer have eggs, you cannot become pregnant by yourself. You will need help. What kind of help? You need donor eggs. So if you're having problems having a baby today, please, the earlier you understand this, the earlier you use all your options, the better. Unfortunately, it's expensive. You need a lot of help. So you will need to consult a fertility specialist. You need a good doctor who will guide you, refer you, review you, follow you up, make sure everybody is taking good care of you. And it's not just enough to become pregnant. When you become pregnant, we also want you to have your baby. So you see, some women will become pregnant and they won't have their baby. We don't want that to be you. We want you to become pregnant and have your baby in your hands. So that's my presentation, very straightforward presentation. Now I'm going to see if I can pick some questions from various platforms. So what I'm going to do now, I'm going to check my phones and see if I can pick some questions from all the portals. Right now, I'm not seeing anybody's comments. So I'm going to skim through my personal page, our main page, our group, and see if I can come up with some questions, okay? So just give me 1 minute. Okay, so COO is currently not order available. I'm just trying to make sure. No, I'm not seeing the questions, not even one person's comment. Correct. Correct. So what I'm gonna do now, I'm gonna check the main page. So let's see what we have. You can ask all your questions. I'll provide you feedbacks right now, okay? I'm getting access to the main page. Hopefully we have a lot of people there. And okay, yeah, let's see. Okay, so please ask your questions. I'm currently viewing the main page and I have a couple of comments, but I don't have any questions. So ask your questions. We have about 44 people in the clinic, and it's an opportunity for you to ask your questions. If you live in Nigeria and you need help, please get a package. The earlier you get package, the better. Tomorrow we'll start promoting our masterclass for May. Our masterclass for May will focus on assisted reproductive technique. So you see all these beautiful female reproductive system. When they fail to perform their role, we can come and take over the role of the sperm, the role of the egg, and take them through different processes, get you pregnant, then introduce the pregnancy back into your body. That process is called assisted reproductive technique. So for the month of May, you will understand IVF better. You will understand IUI better. You will understand surrogacy better. You will understand donor eggs better and adoption. So they are all available avenue of becoming a mother. If you don't understand it, you will never understand it. So if that's your only option of becoming a mother, I wouldn't want anybody to tell me, I'm waiting on God. I know God will do it. God has given you a sound mind. Okay? So guys, start asking your questions. Can you refer someone in UK to a doctor in Nigeria? So this is what we can do for you. Our jurisdiction is Nigeria regarding consultation and referrals. So if you plan to travel to Nigeria, once you enter Nigeria, you'll be qualified. Now we can help you to facilitate and make it easier. If you have a specific time frame you're planning to go to Nigeria, what you can do, you can tell admin, hey, I'm going to Nigeria in June. I'll be in Nigeria 1st of June. So what you can do, the last week of your travel, shoot an email to admin. Admin will set you up by sending you the link so that by the time you are in Nigeria, you are now within the jurisdiction of getting consultation. So once you're in Nigeria, you can decide to get 1 month, 3 months, 6 months, so that once you enter the shores of Nigeria, you are qualified. At that time, we can refer you, but we cannot refer you independent of where you live right now. That's our operational policy. So all the people in America, in UK, in Canada, and other European countries, you are still one of us. We still want to help you, but we play by the books. So the lady in UK, think about that. And the good thing that it's whatever you can get in America, in UK, in Canada, you can get in Nigeria and cheaper. We are doing wonders in Nigeria. So don't think, oh, you're in America, is a lie. There is nothing they do in America they don't do in Nigeria. Nigerian doctors are doing an amazing job. Okay? All right. Apart from seminal fluid analysis, what other lab tests can a man do in order to check for any abnormalities in the sperm? SFA, seminal fluid analysis. When you're checking the sperm, you're checking 3 things. You're checking the count, you're checking the motility, and you're checking the morphology. That's the standard way of checking the sperm. Now, some men might need to go for other investigations with the sperm. They can go for genetic checking of the sperm, especially if you have familial history or a couple of other things. But the standard investigation we'll use your sperm for should be for 3 parameters. The motility, the ability of the sperm to swim past the vagina, swim past the cervix, swim past the womb, and get to the tubes. The morphology means how good looking are the sperm. Then the count is just, how many of the sperm you've got. An average ejaculate for a good man should be about 39 million sperm. 39 million, think about that. All right. Your question is related to the use of cloves, turmeric, garlic to aid conception. There is practically no role in all the food condiments you mentioned. They do not have any direct or indirect inkling to your becoming pregnant. They are food condiments. You can use your cloves, you can use your turmeric, you can use your garlic. If you want to use them for your food, you can use them, but they do not influence or remove from you becoming pregnant. Absolutely no direct connection. Okay? All right. Someone with ovarian cyst at the right ovary, what can one use to clear that? Now, my people, you have to use the right terminology. There is no magic quick fix in gynecology. Thankfully, majority of the ovarian cysts you will have are called functional cysts. Functional cyst means they are there, they are part of your cycle, they will not stop you from still becoming pregnant. So I'm not really going to worry about that. Now, some women can have significantly big cysts that can cause them symptoms, and if that happens, you can go for removal of those cysts. But there is no magic drug that once you take the cyst will disappear. Be careful. Some people will use that to deceive you guys, okay? What role does progesterone play in pregnancy? I love this question. You see, there are important reproductive hormones you need to be conversant with. I'm going to mention them. Estrogen, powerful hormone. There is absolutely no way you can be a woman without estrogen. You need your estrogen to be within normal level. We don't want it to be high. We don't want it to be low. Progesterone. Progesterone is the so-called pregnancy maintaining hormone. Progesterone is what will make the cover of your womb, which is called the endometrium, to be thick enough to support pregnancy. When you don't have adequate amount of progesterone in your body, some women will not even become pregnant. Some women, when they become pregnant, they will have miscarriage because the foundation is thin. The foundation is not strong. So progesterone will maintain your pregnancy until you give birth. Very powerful hormone. Now, if we discover you don't have enough progesterone, we can supplement your progesterone until we have enough before we can proceed. And what percentage is needed to achieve pregnancy? If you're going for IVF, we'll check the thickness of your endometrium and we combine estrogen and progesterone to get a particular thickness. So it's what your fertility specialist will discuss. Okay? In one of your videos, you said we don't know the cause of fibroid. Correct. The exact cause of fibroid is not known. So then what could be the reason for it to grow faster? So this is what we know. Majority of women with African descent, so if you're American African, if you're Nigerian African, if you're true African, black, possibility you have fibroid in your womb, it's almost 99%. So we have about 37 people in the clinic now. If we check your womb right now, for women within their reproductive phase, it's possible that 20 of you might have fibroid. Some wouldn't even know they have fibroid until they've completed their family. Some will find out when we begin to investigate and evaluate their fertility. So no one knows exactly what leads to fibroid, but we know it's commoner among black women. Now, lifestyle. Of course, there are some lifestyle that might help to aid the growth of your fibroid. So if you just eat anything that comes your way, if you eat highly processed food, if you don't eat a lot of vegetables, if you're adding a lot of body weight, if you're under a lot of stress, they can predispose you to having abnormal outcome of your fibroid. Normal healthy living, modified lifestyle, avoiding alcohol, avoiding smoking might help you to manage your fibroid better. It's not all fibroid that will give you trouble. The ones that will give you trouble, we deal with them. It's not all fibroids we need to operate on. The ones we need to operate on, we need to operate on them. There are two types of fibroid that can affect your ability to become pregnant because they are located inside your womb. Intramural fibroid and submucosal fibroid. Okay? Good evening. You were diagnosed with both fallopian tubes blocked and with fibroids. Is it possible you get rid of a fibroid, your fallopian tubes could be open? Now, my sister Helen, no, so do you want me to tell you the truth? There is no need going for things that will make things worse. Your tubes are very sensitive. Unfortunately, the surgeries we can use to go and correct the tubes can make it worse. Especially if you live in developing countries like in Nigeria, possibility they will correct any blockage there is almost limited. So if both of them are blocked, unfortunately, you need to go for IVF. Now, since you have fibroids, you need to deal with the fibroids. If they are significant, we remove the fibroid, then you prepare yourself and go for IVF. I will personally not want you to go and waste your money and time going for any of those promised blockage, removal, and all that. It doesn't work. Okay? All right. Planning to go to Nigeria this month, is it possible for, of course, like I mentioned, if you're planning to go to Nigeria, send us an email. Send us an email at snowspirations.com, snowspirations@gmail.com. Tell admin when you're planning to go to Nigeria. So this is May. If you're planning to go next week, shoot us an email so that once you get to Nigeria, we can refer you. You have to be in Nigeria before we can refer you. We don't refer everybody. We refer people we know. So I want to know who you are before I refer you. Okay? Is it possible for a lady not releasing during sex to be pregnant? What do you mean by not releasing? Women can have, fluid come out from their vagina and all that during sexual intercourse. It's just the vaginal cells, the cervical cells, and the fluid. So you're supposed to elaborate all those fluid to expedite the process of lovemaking. That's what makes lovemaking interesting. Women will be wet, what you guys call wet. So what makes you wet? You desire your partner, you're in the mood, you are ready, and your body will release all those fluid to get the vagina ready. Some women will notice a lot of fluid coming out from their vagina during lovemaking. It's completely okay. Women do not have any other role with those fluid. The fluid we want to be released is the semen. What comes out from the penis is what will get the woman pregnant. Whatever comes out from your cervix, of course, is going to help the sperm to go in, but that's the only mechanical role. Okay? All right. What's the best drug to take for busting ovulation for twins? This is another misconception. So there is no magic drug that once you take, you have twins. It doesn't exist. We can use fertility treatment for women that are qualified, and there are some drugs we can use to challenge your ovaries to give us a lot of eggs to the process of superovulation. But you cannot and you should not by yourself start taking drugs to become pregnant with multiple pregnancy. That's very dangerous. Go to your fertility specialist if you qualify. They can take you through the route of seeing if they can achieve multiple pregnancy. Naturally, if you're older than 35, you have a better chance of having twins naturally. So women that are older will have a better chance of having multiple pregnancy compared to younger women. Good evening. Is it possible after your period stop immediately to ovulate? Yes. Some women will have a short cycle. So some women can quickly release their egg shortly after their period ends. Some women can become pregnant when they make love during their bleeding, not because they ovulated during their bleeding, but shortly after your bleeding, you can ovulate and you can become pregnant. Remembering that sperm can survive in the body of a woman for more than 5 days. So if you release your eggs, let's say you stop bleeding today, and your partner made love to you during your bleeding 5 days ago, he can still get you pregnant. But you cannot ovulate when you're bleeding. Please, when you join, I'm just providing feedbacks to your questions. I've spent about 30 minutes. The last 1 minute is always used for our babies. I love babies, so I normally devote 28 minutes to babies. But if you still have questions, please ask. You should see me on different platforms. My private page, which is my personal timeline. So if you're on Facebook and you're my friend, you will see me right now. If you're in our group, you will see me. If you're in our main page, you will see me. Of course, if you're in our community page, you will see me. If you're in Snowspirations, you will see me. So you have my personal page, my group, this particular community help page, the main page, and the other one. So 5 different places you can view this video. Okay? All right. So if we no longer have other questions, I'm gonna encourage you to start submitting the names of your babies. So the babies you're believing God for in 2023, please submit their names. What's the cause of not ovulating? So many factors. Number 1, if you're of age and if you used all your eggs, you've gone into menopause. So women that go into menopause, they no longer have eggs. They can no longer ovulate. Hormonal imbalance. If any of the hormones I mentioned is out of range, you might likely not ovulate. Increase in your body weight. If you added a lot of body weight, it can disrupt the hormones that will help you to ovulate. Decrease in your body weight. If you have underweight, which means your BMI is below 18.5, you can struggle. Stress, alcohol, smoking, poor lifestyle, poor sleep, they can all affect your ability to ovulate. So if you flip and live healthy and keep a good lifestyle, possibility you will ovulate naturally is very high. Now, if we discover you have eggs but you're not releasing them, we can give you ovulation induction drugs. and they can go and tell your ovaries to release the eggs and you can become pregnant. What will you do because your period has stopped flowing since 4 months? Your age is very critical. Now, I notice some women don't really listen. Women, look, I'm just keeping it real. You guys are 40 in the clinic right now. If you're believing God to be a mother, it's not magic. You need help, get help. Some women don't listen. What will get you pregnant is not the fact that you're bleeding. What will get you pregnant is the fact that you are ovulating. But when you are not bleeding, it might be a danger sign that your fertility is affected. Some women will not bleed, but they have ovulated and they will become pregnant. The most important thing that will get you pregnant is ovulation, not bleeding. But if you have not bled for 4 months, I'm worried. I want to know why. So what you need to do is to go to a gynecologist immediately. We need to know why. If you're in your 40s and you have not bled for 4 months, I'm actually more worried because it's possible you're perimenopausal. It means you are warming up to enter menopause. When you enter menopause, you no longer have eggs. When you no longer have eggs, you can no longer become pregnant naturally. You can still become pregnant, but you will need donor eggs. It's important you understand this because some women will be waiting on no wait. You cannot challenge God when you can obey God. You cannot tell me that what God cannot do does not exist, and you are not seeking help at 49, and you want to be a mother at 50, and you don't have a fertility specialist. You cannot do this by yourself. I'm telling you the truth. You can be the best Christian out there. You can be a prayer warrior. If you don't seek help from a proper doctor, you might delay yourself. There is a reason why God gave doctors enough knowledge to help. Before 2015, so many people I came across didn't know nothing about ovulation. Until I started teaching in 2015, many women can now predict so many things in their body. Many women can say proudly that this is what happens in my body. That's the power of education. That's the power of knowledge. So don't go sitting in one place doing nothing and waiting for God to come down. Gone are the days when manna fall from heaven. And don't always spiritualize everything. There are some women that will come out and attack me because I'm telling you the truth. There is time for everything. There is time to pray. And there is time to make love. You cannot just pray and become pregnant. When you have prayed, you make love. When you have made love, you seek help. Very important. Can nipple discharge stop pregnancy? Yes. If you are not pregnant and you're discharging breast milk, that's a problem. Possibility your prolactin level is very high. That condition of discharging milk without pregnancy is called galactorrhea. We need to go and bring down your prolactin levels so that you can ovulate. So it's a type of cause of not being able to have a baby. Okay? All right, I'm going to start taking names of your babies. Make sure you put the month in bracket. So I have Daniel, I have Emmanuel, and I have Daniela for March 2024. Make sure you put the month of your baby in bracket. If you didn't put the month, I'm not going to mention the name. They told you have a lot of follicles in your ovaries. The doctor said it's much for ovaries. Hope. Follow up with whoever is telling you all this. Follow up. Make sure it's a good doctor, okay? Yes, I can direct you to a place in Lagos, but you have to get a subscription. We do not refer strangers. We want to know who you are. So get a subscription package, 1 month, 1 week, 3 months, 6 months. Okay? Hams, thank you for coming. We've ended the clinic, so I'm just taking names of the babies. Hams is our wonderful member all the way in Canada. Amazing lady. Esther, Dave, December 2023. We are submitting the names of our babies for 2023. So submit the names of the babies God is going to give you in 2023. Kobe, December. Uchenna, June 2023. So Uchenna, your EDD is next month. So your expected date of delivery is next month. If you submitted June, it means you're in your last trimester. All the women in their last trimester should start getting ready. Your baby will come like a thief in the night. You won't even know the day your baby will come. You just think your baby is here. Nicole, Chantel, January 2024. Delay Daniel, Beluso Chukwu, 2024. You didn't put the month. Keep submitting the names of your babies. We have about 38 people in the clinic. Don't be a passenger in our clinic. Anytime you see me show up, participate. If you need help, I can help you. If you are thinking of going for IVF, go and save and attend the masterclass on the 28th. We will make it simpler. The main person that can help you in Nigeria is actually going to be the guest. Okay? So guys, keep submitting the names of your babies. I have David, I have Daniel, December 2023. I have David, I have Daniel, February 2024. I have Praise and Peace, January 2024. I have Kaima, December 2023. Make sure you put the month in bracket. If you didn't put the month, I'm not going to mention the baby's name. We ask God specific gifts. When you want God to bless you, put a month on it. God will show up, okay? Daniel, Emmanuel, Princess Faith, July 2023. So July means in the next 2 months, you'll have your baby. You're currently in your last trimester. Okay? Jalea, Daniel, January 2024. All right, guys, let's go. Make sure you share this video with everyone in your network. So just click on the share icon and share it. We have to continue to gulp positive information. We have to show up in social media and seek knowledge and videos that will help us. What I've noticed, I love all the content creators, but some of us waste time going to places that will not add value to us. Now, people that have completed their family can go and be watching comedy, can go and be watching whatever they want to watch. But when you don't have enough data, when you show up in Facebook, when you show up in social media, go to groups that will help you to become pregnant. Don't spend all your time and your data watching comedy, watching gossip, watching people that are creating contents to make money alone. I'm not here for money. I'm here to help. So practicalize what you learn every day. If you need help, get help. If the only thing you succeeded in getting in 2023 are your babies, you are the richest. If you have all the money in the world and you're not using it to start your family, then why do you have the money? Think about that. If you're using all your money to buy shoes, to buy cars, to buy houses, to impress people, then you don't have a baby. If you have all your money in millions in bank, but you can't go and register for masterclass, you can't get a consultation, then why do you have that money? Think about that for a moment. How do you get the package? You show up tomorrow and admin will address that. Tomorrow we'll launch our masterclass for the month of May. If you're not in Nigeria, you can register for the masterclass. During the masterclass, you have about 3 hours opportunity to get everything you need. So masterclass is for everybody. Consultation is for only people in Nigeria. Okay, Johnson, Atolin, May 2023. Jeffat, Jedida, December 2023. I'm going to give a few more minutes to submit the names of your babies quickly. Okay? Thank you for coming. Now, tomorrow is my traditional 40s Fridays clinic. During 40 Fridays, I select topics that will be very important to our women just about the age 40. 40 is a beautiful age to attain, but you need to be careful because at that stage, if you want to become pregnant, it's more difficult. You begin to experience a lot of changes because your body is getting ready to enter menopause. Majority of women in their 40s will experience dryness of the vagina. Majority of women in their 40s will experience low libido. Majority of women in their 40s might likely be depressed. Majority of women in their 40s might have anxiety. They might have stress. They might think it's all over, but it's never over. Take my word, it's never over until God said so. If you're in your 40s, you can still be a mother. If you're 49, you can still be a mother. If you're 60, you can still be a mother. If you're 70, you can still be a mother. There are different ways you need to do things differently to become a mother, depending on your age. But there is nobody that can be a mother in this group. I don't care your age. But it's not all women that will go through pregnancy to become mothers. There are so many things you don't know. And when you don't know, you seek higher knowledge. Okay? If you need direction, I'm going to help you. My good friend Abai, how are you? How are your babies getting ready? I think we are getting ready for July, right? Thank you for hopping in. Guys, thank you for coming this evening, and hopefully I'll see you guys tomorrow. God bless you, and remember to share this video. Remember to put them into practice. Remember to take time to understand the female reproductive system. And until I see you guys tomorrow, God bless you and have a good evening. Bye-bye for now. Now, yes, I didn't even remember. I have a poll. I have a poll I actually put up, and even the questions. Okay, guys. So I still have 33 people in the clinic. So there's a poll that will pop up on the video screen now. So if it comes up, please give me a feedback. And the question it will come up on your screen. And just provide the feedbacks. Let me see what you think about the questions. And we've had a very good evening talking about the female reproductive system. So thank you so much. And I want to believe I answered all the questions, right? Okay. Thank you. God bless you. And bye-bye for now.